So here's a question. How much do you know about CBD oil and exactly how can it help some patients dealing with different medical problems? With more on this, today's local neurologist, Dr. Chad Domingue, to answer some of those questions. Thank you so much for joining us.
Good afternoon, Liz. Good afternoon to everyone. Thanks for having me.
Great to have you as always. What exactly is CBD oil and what's the connection with marijuana?
Yeah, I think, for all of us, there hasn't been a product that has hit the market in the last 2 years that has gotten the notoriety of CBD oil. I mean, it's everywhere. There's gas stations, convenience stores, everywhere you look. CBD oil is very interesting. Cannabis, which is the marijuana plant, has anywhere from 80 to 120 active chemicals. CBD oil being one of them, THC being another. THC is what we think about when we think about marijuana, getting you high and the psychoactive properties. THC works on two receptors, a CB1 and a CB2, whereas CBD oil doesn't work on those receptors as much and affects a different receptor called serotonin. That's how it works for anxiety. For pain, CBD increases a compound called anandamine, and by increasing that compound, it decreases pain. But the cool thing about CBD is it doesn't affect your brain like THC. There's no abuse potential, there's no addiction potential, and it doesn't seem to be where you develop tolerance, meaning when you take this medicine for a long period of time, it still works.
So talk about how can people access this and how are doctors using it to treat what types of medical conditions?
Yeah, so you can get it without a recommendation. You and I have discussed many times medical marijuana, which you obviously need to see a physician, whereas CBD oil you do not. I did a very extensive literature review, and there's three main disease processes where I saw good data: pain, anxiety, and epilepsy. Epilepsy, I found 11 really strong studies for treatment refractory seizures, and there's actually an FDA product that you can get prescribed called Epidiolex. For children with epilepsy. For anxiety, I saw 6 studies. They were so-so. And the thing that was a struggle with the anxiety studies is the doses were all over the place, 5 milligrams, 1,500. From a pain standpoint, CBD needs to be mixed with THC. When I give medical marijuana for pain, I always tell my patients, it's like bricks and mortar. You got to have the two together for it to work. I couldn't find much data on the topical stuff, though I have many patients that swear by it. I just didn't see the medical literature supporting it.
So tell me about the best way, and we always stress with these segments that check with your doctor first before you try anything. But from your medical perspective, what is the best way to learn more about this for people who may have any questions, and what are some of the things that they may be experiencing they may want to inquire about using this?
Yeah, so the 3 disease processes we mentioned, and the point you make is very good. I got 2 commercially available products right here. One's 300, one's 2,000. And this is the frustration. Which one do you take? And I can tell you as a medical doctor, you really need to lean on a pharmacist or a physician that's doing it at a high level, because the medical literature doesn't make it very clean cut. And 2 warnings I want to give to all of our viewers. First warning, CBD oil can have under 1% THC. So taking some of these commercially available products, you can test positive on a drug screen. So you need to be aware of that. You need to make sure you know what you're getting, where you're getting it from. And the other warning, CBD oil can induce liver enzymes. So patients that are on blood thinners like Coumadin and warfarin, it can affect that medicine. So you really, as you mentioned earlier, you need to make sure your doctor knows you're taking this product.
But it's good that you're shedding, some information on this particular oil, and that it's something that people can inquire about. And of course, I know you've got your online stuff. You're always answering questions as well, right?
Yeah, so Facebook, Dr. Chad Domingue, Instagram, Dr. Chad, my YouTube. I'm doing several videos on CBD as well as marijuana coming up. But it's very interesting. This is a very exciting field, but there's just still a lot that needs to be done to give us some definitive answers.
Thank you so much, Dr. Chad, as usual. Appreciate it.
Always a pleasure. Thank you so much.
Thanks.